we both realize and know that that friction cannot keep us from at least having discussions like this. That friction cannot keep us from trying to figure out ways to move forward. So I just wanted to open by saying that. Secondly, I have to leave at 6:30 because I have another event to go to. So we have an Officer of the Year dinner that the Ventura County Kiwanis Club is putting together. So it's not because I'm being rude, it's because I have to put on a tie and go to another event. Secondly, always helpful to have my wingman with me, is what I'll call Scott. Scott is one of the acting assistant city managers right now. At the same time, he's the assistant chief, so eventually he'll come back home. Looking forward to that. And then secondly, I do have Elaine Crandall with me. We ran into each other at a board meeting, had many conversations from the mental health side about what the county is doing. So I just want to keep my comments brief about the presentation. And I do want to talk about the crisis intervention team, although I know, Armando, you have a different philosophy on that. I read the VC Reporter.
Did you?
I did, had to, got to read everything to find out what people are saying. So I know, right? So that's what I'm talking about. So in Armando's article, he made some statements based on how he thinks and perceives about the CIT program. But I want to preface my comments by saying, as law enforcement, we could be doing nothing. We could be sitting around letting bad things happen, but I do believe and know that the crisis intervention team training that we have is not just a statewide renowned program, it is a national program. And some of the things that we talk about and share and train with our employees and our officers as well as our dispatchers are everything on de-escalation of force, active listening, weapons prohibition, child and adolescent disorders, adult protective services, developmental disabilities, mobile crisis teams, working with the mental health culture, so that the unchallenging or the unfortunate situation with law enforcement now is that we get called for everything. We are supposed to be the subject matter experts on everything from mental health to domestic violence to child care to child psychosis to drug use, you name it. We're supposed to be those subject matter experts on everything. And quite frankly, I think the community should step out and be more of a resource in conjunction with the law enforcement community to help assuage some of these concerns. I am an advocate of taking care of the problem before I have to take care of the problem. And so let me use a very good example. So when I talk to parents about disciplining their children, about talking to their children about what's right and wrong, I would prefer the community and the families discipline their child, because once law enforcement gets involved, it's a different discipline process. So why not teach and train our kids early and young? Why not get those persons who either have psychotic episodes, have issues with mental health, why can't we get them services before you have to pick up the phone and call me? Because when you call law enforcement, it is typically the last result. It is the, I'm having the worst day of my life, I've been involved in 5 fights, the cops have come to my house 15 times, and now, once again, we are there again to try to address something that's been long-standing. So I do applaud you community members for at least being here to listen and hear and ask questions, because there's no way we're going to get from point A to point B or point Z without these kind of real conversations. And I will also say that although we may not agree on certain things, I will definitely be upfront and honest with you and tell you why we do things. And it may not be what you want to hear, and I'm okay with that. And you may say things I don't want to hear, and I'm okay with that too. But if we don't begin these kind of conversations, we will not make progress in our community. I will say that. So with that, I don't know what else to say other than just two quick seconds, Armando, just like two seconds.
Absolutely.
So OPD has trained 125 of our officers at all ranks in the department. And it's not just the police officers on the street. We train dispatchers, we train booking officers, we train everyone in our structure in order to help them do a better job of dealing with persons who have mental health issues. So, thanks.
Okay, again, for the new people, because I see some people here that came in a little late, we're following a real rigorous structure, okay? The chief, city manager, assistant city manager, commander, assistant chief Scott Whitney, and the new title. They're here, and they're going to make their presentation. If Elaine has something to say, she's more than welcome to do that. Then you are getting paper to put your questions. That's how we're gonna do it. You're gonna give them to Debbie and you're gonna give them to Jim. Jim is gonna read those questions. What we're gonna do is hopefully take away a couple of things that are mutually beneficial to the police department, to this group, that benefit the entire community. That's what this is about today. This isn't an I got you stuff. This is not, this is not what that is. Today we want to, she talked about crisis intervention team. We have a real interest in that. We have some other interests. We're going to talk about that. We're not going to platform. We're not going to stump. We're not going to, pontificate today. This is not the place. We have only got an hour. We've got to get busy. This is very historic. So, Scott, do you want to say anything?
Sure. I didn't have anything planned. I think the chief did a nice introduction, so I won't take up too much time. My name's Scott Whitney. I started with the Oxnard Police Department in 1990. I was born and raised here in the city. Been an assistant chief. We have 2 assistant chiefs at our department. So I've been in that assignment for the last 8 years. For the last 5 months, I've been working in the city manager's office as the interim assistant city manager. That's where it gets confusing, where everybody says, hey, what's your title? Yeah, so that's what I'm doing right now. What else? I started, so before I get to CIT, I really started this job I was born and raised in Oxnard. I started in this job to try and make the community better. I can tell you from when I started in 1990 to where we are today, it's a different police department. I think it's a much better police department. I think when you can compare us in the state and the country, we are a very progressive police department. I'm not here to brag about everything, but we've done a lot of good and progressive things. Is there room for improvement? Yeah, there sure is. Yeah, absolutely. I think you could say that about any government agency that serves the community, there's tons of room for improvement. Particularly when you go further down the socioeconomic scale and you go into communities that need the most services, that's where the biggest gaps are, and that's where government, there's some significant room for improvement. People in one community may have different needs and wants from the government, from police, schools, whatever it is, than people in different cities or different communities. As a police department, as a government, we need to be tuned into that. Where the gaps are the biggest, that's where we need to do the most work. And a lot of times that doesn't happen because we become adversaries, and that doesn't need to happen. We don't need to be adversaries. We don't look, I've hired, I've been in the hiring of every single officer that we've hired over the last 8 years. I can tell you we hire like really good people. We try our best to hire people from within our community. We do not hire people that are racist or anti-Semitic or bigots. We just don't hire people like that. We still have a system where in some ways it's rigged against people that don't know how to work the system. It's this idea of institutionalized racism. If you would have asked me about that 8, 10 years ago, I'd have said absolutely not. There's no way. But as I've learned, I know that exists. I know that now. As a police department, as a city, we need to do our best to identify where those inequities exist, and then do our best to try and address them. And I can tell you firsthand from within the police department, there's several instances where we have done that. Going back to being adversaries, that's exactly what we do not want to do. We do not want to be adversaries with our community, with people that need our services. In a lot of ways, they need our services more than people in other neighborhoods or other cities. And so whenever there's an instance of mistrust of government, city, police, we need to fill that gap. gap. We need to address it. We need to be willing to come to a meeting like this and hear what people have to say. So we'll show up, Chief and I, others from the police department, we'll show up anywhere where we think it can be productive. So there's a lot of stuff I'm sure we'll get into CIT, and I'm sure I'll kind of swing back around to this idea of being adversaries or not. And I do have an opinion. I respect Armando. He knows that. I hope it's mutual. When he does write pieces, I'll tell this to Armando. When he writes pieces like he did about the CIT program that, from our perspective, just is not fair, I think I will argue that it creates more of an adversarial relationship than it should be. I praise him and Debbie for being willing to have this meeting and to have this open dialogue, because I think that is part of the other side where we're kind of smoothing it out, as opposed to being like this. We can work together, so I applaud that. I thank you guys for showing up as well. And I don't want to take up too much time, so I'll just look to hopefully answer whatever questions you guys have and get some feedback from you.
Chief, I think that, because you guys were super brief, I think that we have time, but no stumping, guys, no sermons, okay? We can go around, identify ourselves. It's important that the chief and that the people here, Scott and everybody, know who you are, who you represent. No stumping, okay? So let's go. Armando Vasquez, okay?
And I'm Betty DeVries.
Eileen Tracy.
Jim Gilmer,
Ruth Jones.
Vinnie Creighton,
Your name, Jackie.
Jacqueline Viaggi, artist.
Francisco Magdalena.
Victor Perez,
Adam Kelly.
Josh Ruiz.
Miguelito Trujillo.
Patricia Arellano.
John Montgomery,
René Corado.
Louis Trinidad,
Pastor Benito Juarez.
Norma Juarez.
Just Tears,
Karen Soda. Elaine Randall.
Identify yourself, brother.
Eugene Alonso.
Hector Alonso, Joey,
Jose Padilla Alonso.
Joy Wenslaw.
In the back, Julie.
Julie. Nympha.
Pedro Flores.
And the young kids that are already electronically hooked up. Okay, so I think, do you want to say something, Elaine, and your associate, please?
Oh, thank you. I'm here because I live in Oxnard. We have known Debbie and Armando for a long time. And I've had this job for about 4 months now. And one of the things I'm committed to is to listen to the community, just like Chief Williams. And all of us are here to listen, because we do know that government institutions can, as Armando one time talked about, it's like this big block. Sometimes it's very hard to get in there. I get that. And I also wanted to hear about what you had to say about the CIT training, the curriculum particularly. You're finding it displeasurable. It is a nationally renowned program, and if there are ways to make it more applicable to this particular community, I would like to hear about that. That's why I'm here, just to listen and learn. And this is Karen Sahota, and she has for many years been a trainer for all of the police departments, and she now works in the behavioral health department. So she knows both sides of two big institutional boxes. And whatever it is we learn here, we'll come back in the office and talk about it all together and see what we can do to make things a little bit better. And just like the chief, I really appreciate everybody's time on a Friday night to come out here and speak to us, and I appreciate us coming out here and listening to you.
Can I just make one comment? If you are thinking of a question, could you begin writing them down now so that we can collect them without a lot of...
And I just wanted to add one more thing. I wanted to say about CIT training. If you will, when I looked at it, it reminded me of safety training. It's a kind of a way to let people know in advance how to avoid a very bad thing from happening by being more educated. And it's very hard to start looking at things like, when you look at safety training in all industries, it's always been a challenge, because one of the things in the county we try to measure, Chief, how did safety training influence the number of people who went out on workers' compensation? How can you prove that this training caused that? That's kind of kind of a national question that people always have to ask. But because you can't always answer, it doesn't mean you don't do it, right? So this is the best that we have right now, and we are always interested in making the best better, because nothing's static. So I just have to say, the sheriffs and the police, it started off with our sheriff's department. None of the police departments were mandated, were they? They volunteered to yeah, everybody volunteered to step in and take this particular training. And so I really applaud that. And does that mean that it avoids every kind of accident? Like, does safety training avoid every kind of accident? No, it doesn't. Bad things still happen. And I would say that that's true in this particular case as well. I think we're still all people and vulnerable to mistakes. And but in terms of the systems, we're also looking at improving systems.
Just, Elaine alluded to, I'm sure Karen will, I know Scott did, the CIT program is a county-wide program. So every law enforcement agency in this county works together in the CIT program. And I will tell you that is not normal, to say the least, by any stretch of the imagination. Most times there are rifts between different law enforcement agencies, the municipalities, the sheriffs. In this county, we're very fortunate to have a working group of professionals that we have both at the chief and sheriff level as well as the officer level willing to work together, and we actually fund this program because that's how much we believe in it, is we all contribute a certain amount of funding to the program. Just want to make sure I said that. Thank you. Thank you.
I have to say I'm very proud of being part of the CIT program. I came on a couple years ago and really looked at the training, and so I'm actually really proud of the fact that in the last 2 years, I just came over to BCBH two months ago. Prior to that, I did run the CIT program for our entire county. And as Chief Williams says, just said that in our county, we currently, in the state of California, have yet to find another one where all police departments and the sheriff's office all fund one training program, and that it's consistent across the board. So every law enforcement is trained in the exact same way, whereas some counties you may have they're trained in one type of a CIT training, or someone might get 8 hours or someone might get 24 hours. All our officers and deputies go through 40 hours of training. And I really did look at the classes in the last 2 years, and I spent a lot of effort in really making sure it was new, hands-on type of activities. It wasn't just a classroom lecture. And I really have noticed such a change in the last 2 years of the interaction, bringing active listening and crisis intervention, and really, really proud. So much so that some of the other outside agencies out of our county are now being trained in our county, because we have one of Ventura County is a model of CIT in the state of California. And that's something to be really proud of. I mean, so much so that the founder of CIT, Sam Cochran, knows us and comes to Ventura County for information when they look at their own Memphis model, and as they look at CIT changing and growing, they oftentimes will ask Ventura County for information. So and of course I'm a little biased, of course, because I did run it for the past couple years, and I did make a lot of effort in the community outreach and the partnerships within our county. We are the only county in California that can claim partnership with our BCBH and the hospitals and all the different law enforcement. So I'm just really proud of our program.
So I'd like to say something about that article. I wrote it, a month and a half ago. It came out in the Reporter today or yesterday. So there's a lot of reporters back there. I recommend that you guys read it. Scott said that he has now conceded that there's institutional racism within institutions. I would say that there's institutional exclusion. And that's why OWN was born or founded. We want to be part of the decision-making process. In a democracy, the people that trump are the civilians, not the people that we elect or that we hire, but the citizens. And if I wrote what I wrote, as much as I feel that it's the truth, in Mexico I'd be dead. So thank God I'm in the United States.
That is true.
And I absolutely, I'm an immigrant and I love this country.
Me
And I
too.
love it because I can say
Freedom of speech.
freedom of
First Amendment.
So having
One
said
of us
that,
has a space.
Interrupting is right.
yes, so
Okay.
We can have
Okay,
coffee
and
now.
what I have right now about 6 of the comments, so please, if you have some other questions, and if they're different from the ones we just asked, please, just pass them around and receive those easier. I'm just gonna ask the way they're written here, and we'll see if who's the most appropriate person to answer. The first one is, we understand that police officers receive universal training, the academy and beyond, so they have a toolbox of resources to use when deployed. Why do some departments emphasize a hammer approach versus a peace officer community relationship approach as it relates to urban, ethnic, racial communities?
That is a broad question to answer, but I will answer it this way. So, the city of Oxnard Police Department has been having many conversations about I don't want to say it's a new notion, but the idea that we have to be trustworthy in our community. You have to find what we do in our actions trustworthy, factual, and legitimate. If we don't have that, then there will be a constant erosion of trust. So in some of the other things that I do with the state, we have a state of police chiefs who get together, and we are working on building training in what's called legitimacy and building trust in our community, so that for certain, we have a guardian mentality versus a soldier mentality. So if you look at our law enforcement agencies, 20, 30 years ago, we were a soldier mentality. We are the troops, we are the soldiers, we are here. We have now progressed based on what our communities are telling us, based on national attention to all kind of crazy stuff going on in law enforcement. We have to shift our culture from troop to guardian. And as peace officers, not police, P-E-A-C-E, it is our job to instill that trust and that peace, but we will have to work through that cultural process of training. I would love to believe that I signed up to be a peace officer. I know Scott would believe that we've signed up to be peace officers. The flip side of our job, though, that there are some people in the community who don't want to be managed by peace officers, and that's why you have us here too. So it's an interesting dynamic, great question, but your statewide law enforcement chiefs are working through that process of getting training on police legitimacy and trust, and it starts with discussions like this.
I'm going to continue. Here's another question that relates to specific incidents. The person who wrote this said, I went 2 years ago to the Oxnard Behavioral Health with my fiance because I needed help. I wasn't feeling right or normal. The doctor suggested I go to the hospital. I refused to go, and the doctor then called the police department. The police department, a woman came who spoke Spanish, handcuffed me very strongly with my wrist. On the way to the hospital, she drove very fast, braking really strongly when she hit a red light. I told her I was hurting my wrist. Why was I hurt when I went to the hospital for help?
All right, so let me ask the question, and I'll close my eyes if you don't want me to know who asked the question. So was this the Oxnard Police Department?
Yes.
Okay. So did you call, or did whomever was involved in this incident, did you call us and let us know that this incident happened? Meaning, let me explain it, and then I'll get to it. That should have never happened. I will say that. That should not happen. You shouldn't be handcuffed. If it happened the way that you're saying, none of that should have happened. But remember when I started the conversation by saying, it would be nice if services were provided in the front end, so you don't have to pick up the phone and you don't have to call us. So what I hear in that question is that the doctor was beside himself trying to figure out what to do with someone in crisis. Who do you call? You pick up the phone and you call police officers who may or may not be equipped to deal with and manage that. And the reason why I asked if you called is because if you do not feel as though you've been treated fairly by the Oxnard Police Department, what should you do?
Report it.
Report it. Don't sit there and take it and think that it's just going to go away, or just think that I'm on my own or Scott on his own is going to know what's going on everywhere. We have encouraged people from the time I've been here, certainly before I got here too, that if something is wrong, we need you to call us and let us know. I can't fix it if I don't know it. And albeit, again, I preface the comment by saying that should have never happened if it happened that way. But I think that there were so many frustrations there that I wish our mental health system or how things work would not have dictated calling law enforcement.
So Jackie and others, call the police department, file a formal report. Call Elaine, file a formal report. Now you've got a body here called OM. Talk to us.
Talk to you.
Yes, come and talk to
I'm
us.
not going to come talk to us.
Yes, absolutely.
The part that I was just going to say, I think that sometimes this issue of not having the trust or not having the support, if you've been, and I know that this person was very much traumatized by the secondary experience, not counting the first part, it would be very difficult to know what to do.
Okay.
And then also the fear factor of
Absolutely, yeah.
what if you have that same sort of thing happen again? So I think it's not a simple thing of just reporting in the traditional channels. I'm just trying to report.
But the community can help.
The community
But
can
now
help.
we have the coalition.
Now we have the coalition.
But
Now we
I
have
just
to
want to
go.
know, if the person that was annoyed like that did report it, what would happen next? What would you do next? And what solution would that person receive?
So if that person didn't feel comfortable calling us and went through Armando, even if we got it firsthand or got it secondhand, we take every complaint seriously. So that complaint gets investigated by several investigators. They will talk to the person who's calling in, they will talk to the officers, they'll get to the bottom of the situation, and if some wrongdoing happened, we will take care of it, educate, discipline the officer, and that's how we take care of things. And I'm glad you asked that question, Elaine. I can definitely count on you to ask questions. We receive a number of citizens' complaints, and we take those seriously. We don't just throw them in a circular file and just say, oh, I'm sorry, the cop was right. We've been very judicious about what we do, so much so that we're an agency that has an auditing sergeant. So we audit our citizens' complaints. We audit policy and procedures and practices. We are one of the most transparent agencies in this county.
Is the
Nice.
complainant told about your resolution?
I'm sorry.
Is the complainer told about whatever?
They are told when the situation has been resolved and that we've taken care of it. So they are notified.
Yeah, and they're told what the finding is as well. And the reality is, the interesting part is we don't really get very many complaints. So sometimes you wonder, why is that? Because we're doing a great job, or is it
Some of it could be
because
someone
people
being
are afraid?
traumatized.
This is
And if you think, so I mentioned earlier, we hire, and I truly believe we hire good people. We hire good people that have a tough job, very tough job. And we hire people from the human race. And if you think about, no matter where you go for service, it's a doctor's appointment, you go to the theater, restaurant, the bank, the DMV, imagine all those places that you go for service, you run, and you have less than stellar service. We've all experienced it. I experience it every time I go to the DMV or the post office. But typically we don't complain about that. We remember it, but we don't complain about it. The same thing happens with the police department, except it's amped up a little bit because usually when the police are involved, it's not a minor incident like if your license renewed or something. But sometimes we understand that sometimes there's issues where there's a bad experience, there's no complaint, we don't know about it. It's really hard to change that, really hard to change that. If we hear repeated complaints about the same person, we know it. It's kind of like ticketing somebody that is speeding. If the same officer keeps getting complaints, that behavior is going to change.
Yeah, I would just like to say on behalf of comments that I've heard over the last years, I think that one of the crucial areas for us to talk about how we can improve our community is how do we get the message out about the complaint process, and then Chief Williams had an idea that maybe we need an intermediary place. For example, here at the cafe. But the main part is, I think if you're not hearing the complaints, that in itself is an issue if you're trying to figure out how trust building begins. So.
This is mental health, guys, and the way you resolve mental health is by communication, to a large degree. So if you've got it, it's eating away at you. Here, we can discuss it, and then we can channel it to the proper direction, right? I think that that's a great idea. So we're, working on some good stuff.
Okay, I have a couple of questions I'm trying to group together, but here's another one about this cultural congruency. basically, how would you incorporate cultural congruent elements into the CIT? Specifically, microaggression, micro-assaults, racial, gender, ethnic, diverse perspectives about the best way to approach issues.
So I'm always going to have Scott answer that question because that speaks to our cultural proficiency that the